pull the curtain to provide some privacy, go into my patient's room, introduce myself, and tell them what I was going to be doing. And if they had any questions, obviously I would answer them. And I would also check the armband and make sure there was a doctor's order to place an NG tube. So after that, I would wash my hands, get a check, place that over my patient, put on, and I would check the nose also to make sure there wasn't anything wrong with it. So I would check patency and have him breathe out of both nostrils, and then check and see if there's any obstructions, see if he's had a deviated septum, if he's had any trauma or any surgery completely. And I would raise the bed and have my patient sitting at a 60 to 90 degree angle so I can get to his nose. And I would also raise the head of the bed so it's more at my level. And since I'm going to be standing right by my patient, I'm also going to put aside the band. Now that that's done, I'm going to put on gloves. I would wash my hands again since I've been touching the bed. Okay, and then I would lube, measure first, see how far down I need to go. So measure from the tip of the nose to the earlobe, and then from there to the xiphoid process, which is about here, and then I would mark it with point marker or a piece of tape. Tell my patient that I was getting ready to insert the tube and to take a deep breath. And I would have a cup and I'd have my patient hold it and tell them to keep swallowing once I got past the throat. And if you meet resistance, just kind of spin the tube. So I'm meeting resistance there. So I'm going to put air into the tube. And listen when I put the air in to make sure I hear air in the stomach to make sure that I have correct placement. Go swishing when you do that. And then before you would disconnect it, you would pull back to make sure that you get gastrous juices. Which you should. Then if I needed to hook it up to suction, I would hook it up to suction. Then I would get a piece of tape, or I would wipe off my patient's nose, and then get a piece of tape so I can secure the tube. Rip it about halfway. Hard to do with gloves on. Rip it about halfway, place it over the nose, except you wouldn't have that much extra tape on here. And you don't want to block the nostrils, so you kind of cross over and put back on the nose like that. And then I would secure it to gown. So, and give him a little extra room so if it pulls, he's not going to pull the tube out. And then you would pull on it to make sure that the tube's not going to come out. And then after the tube's in, I would document how my patient handled me putting in the tube, anything that I pulled out, if there's suction, how much is coming out of the tube. And then I would make a plan of care to provide nostril care for my patient, so changing the tape, making sure there's not any incrustation or anything around his nostrils, and make sure that his nostrils are dry so there's no skin breakdown from the tape. So to remove the tube, and once there's a doctor's order for that, which I would check for, I would come in and I would unhook the tube from suction and cap it off for about an hour to see if my patient had any nausea or vomiting. If he did, then it's probably not time to disconnect to take the tube out, and I would let the doctor know that my patient was having the nausea or vomiting. After that, I would put on my gloves, introduce myself to my patient, and wash my hands again. So come back, remove the tape gently. And I would pull the curtain also to provide for privacy. Put the chucks back on my patient and have Kleenexes ready for him. So I would disconnect the tubing from the gown, and then I would clamp the tube before I pull, and tell my patient to take a deep breath and hold it until I have the tube all the way out. So I would pull quickly and then discard of my tubing as necessary. I would have the paper towel here to kind of wipe my patient's nose, have him blow his nose to make sure he doesn't have any gastric juices in his esophagus, and to clear everything out. I would then document the date and time I removed the tube, how my patient did with the procedure, and put my patient's bed back down and see if I could get him anything while I was in here, and do that.